Well, Notable Solutions is another company that I've been involved with for a long time. It was started by two brothers who immigrated from the Middle East. I am a huge believer in having America become the mecca for entrepreneurs all around the world. I would like to see us open our doors to entrepreneurs. I would not like to see us educate people in technology and then throw them out because they can't get permanent residence or even visas to stay here for a while. There is a huge community of Indian American entrepreneurs. I've been involved with TIE DC. TIE is the Indian Entrepreneur. It's a huge organization. And I have several clients who are run by Indian American entrepreneurs, including the company that does the NIH cancer database work. The Notable Solution people were originally Iranians who had been here for a long time. They built a very nice company. They basically developed middleware for peripherals, copiers, scanners, what have you, and sold in partnership with many of the equipment manufacturers. And they attracted venture capital from Edison Ventures, and ultimately were sold a couple of years ago for a very handsome price to Nuance. And so what has happened? The managers from Notable Solutions have started other companies. So the cycle continues, and those people have proven that they can be successful, and they're known to the investment community. The fellow who was at Edison Ventures is now with another venture capital company, and so there's another opportunity there. Noxalizer, I have also been with since it started. It's been through a couple of management cycles. Noxalizer is a good example of how exciting and yet difficult it is to develop a new technology and change the way people do things. Noxalizer developed a nitrogen dioxide-based sterilization method for medical products and medical instruments. All of the other existing methodologies have not so good effects on modern polymers and other substances that are used in drug-eluting stents, pre-filled syringes, various things that go into the human body. Some of these sterilization methods are so dangerous that they're done off-site. Ethylene oxide is flammable and explosive. People who use ethylene oxide sterilization send their materials out to facilities in remote locations for sterilization and bring them back. That's an expensive, time-consuming process. Nevertheless, to change the way an industry, particularly the medical industry, does things requires a lot of effort. It requires academic articles, it requires persuading the FDA. So it takes patient capital to develop a new technology like this. I'm involved in another company that's developing new water purification technology, and it's a similar case. And another one that's developing a new technology to increase the efficiency of natural gas powered engines that drive gas pipelines. These things take a long time and they take a lot of capital to persuade people that they work, to understand how they work, and to get people to adopt them, even assuming that they're efficient and they save money and they produce better results. So Noxalizer has now reached the point where their technology is accepted. They have orders and they have delivered machines to many of the largest companies. So they're now at the phase where they can actually go out and sell their product in significant volumes. Along the way, they had a Japanese competitor that had a lot of money invested by the University of Tokyo Venture Fund and had a large patent portfolio. Fortunately for us and unfortunately for them, our patent portfolio was senior to them in priority. The short story is that Noxalizer acquired the Japanese company. So Noxalizer now has a Japanese subsidiary and some very talented Japanese engineers who have some additional products that have been added to the Noxalizer product line. So that's a success story for Maryland. The biotech tax credit was important to Knox-Elizer for raising money, as it has been to a lot of Maryland companies.